Here.
Like this? Like this?
I think we might be doing it right. I don't know. We're going to have to input the music into that one.
This brings me back to the day.
Hey, unhinged hygienist. Yeah.
Oh, that was really good. Lauren's on it. Yes.
See, it's because I'm on vacation. When I'm on vacation and this brain has cleared out, I woke up at 5 a.m. yesterday and today. My aunt and I, we went out and watched the sunrise on the ocean and went for an hour-long walk. I am grounded, I am whole, I am peaceful, and I am ready to bring it with our amazing guest today. So I say, welcome us back in to see us. Bring us in.
Welcome back to the Unhinged Hygienist.
Squirrel.
That's what we do. We squirrel a lot, like a lot. But yeah. So today's guest is someone you've probably seen all over social media, dental conferences, podcasts, speaking events, and honestly everywhere. Everywhere.
Today we are hanging out with Matthew. You will be. We're hanging out with Matthew Bradley, also known as the Guygienist.
Thank you.
Yeah.
Thank you.
Yay. It's fun.
And if you're in dental hygiene and haven't come across Matthew's content yet, you've somehow managed to beat the algorithm.
That's hilarious.
Everywhere.
The algorithm is a sneaky thing, right? So
it is. It is.
And I
had one reel get over 8,000 views, and Lauren's calling me. She's like, "What did you do?" I don't know what the hell I did. I don't know. I don't know how to do it again.
I don't know. We're going to have to do it. So I don't know. I think maybe because Matthew has a lot of hats. Like he's an educator, an advocate, a speaker, a content creator, and one of the people who is pushing our hygiene profession forward. So maybe that's where you get the algorithm.
Yes.
I don't know.
Which is amazing.
Yeah.
And today, we're going to go beyond social media with Matthew today. We're going to be talking about his journey. I'm sure being a male hygienist, I'm sure that's come up a lot, right?
Mm-hmm.
Yeah. I'm not the most common denominator, I guess.
Yeah.
But you've also built a brand, you're creating opportunities, and we want to know where you think dental hygiene is going.
So on that note, we would like to welcome you, Matthew, to the Unhinged Hygienist.
Thank you. Thanks for having me, guys. I'm excited. This will be fun.
I think it is going to be fun. We have been really gifted with some great guests, and I'm excited to have you within our first 5.
Sorry to be the first bad one.
No, there are no bad ones.
No, everybody brings value. We are all valuable. No,
it's funny because when we started and I was reaching out and people were like, yes. I didn't realize so many people would say yes. And now we're literally filming 6 to 8 episodes every month with guests. And I'm like, oh my God. I'm like, we have to
we got to break it down.
Which is fantastic. Yeah. I love it because,
it's a good problem to have.
It's really nice connecting because you see people on social media like you or Michelle Strange or the Curvy Scale or there's so many people, Amber Augers, and you're just wow. Now you're actually talking to them and it's really humbling.
I think a lot of us for me on social media, it's because I found my voice, right? I stopped just trying to be there's a lot of people that make comedy and humorous content, which is great. That's enjoyable, but that's not me. I'm not out here just trying to make people laugh. The whole reason I got into hygiene was to try and make a change, make an impact, right?
Amen.
And I don't care where my audience comes from. If I have a chance to put that message out there, then 100%. And I think that's a lot of people that have a following on social media, right? We have something that we're trying to convey to the world.
Yeah.
And if it's 5 people, if it's 5,000 people, that's still more people that get to hear, what we have to say.
And if you get to the opportunity to be authentically you, that's what comes through, right? That's why
100%.
people are drawn to you. They're drawn to your channel. I know for me, I want to go back to the beginning. I want to start before the socials, before all that stuff.
Yeah.
Who's Matthew? Give us the intro. Who are you?
So I grew up in Northern California.
Okay.
This is kind of the reason why I got into hygiene in the first place is I had a ton of cavities growing up. Every time I'd go to the dentist, it was 3 to 5 every 6 months, right? Um, and it was something that was like
You're gonna
really
run out of
hard for
teeth.
me. It was like a massive point of like insecurity for me.
Yeah.
Like I legitimately thought by the time I was 18, I was gonna have dentures, right?
Yeah.
And they would ask if like I was brushing and flossing, and I was trying to do the things. I just wasn't doing them in the right way, right? And so I I had some like bad experiences in the dental field, and I decided to become an assistant because I was going to go to dental school. And so instead of getting shadowing hours, I was like, I'll get paid to shadow. Like that sounds nice.
Yeah.
And then as an assistant, I learned more about the dental field and the role that hygienists play and the potential role that we can play, I believe. And so I decided to like switch to hygiene. But really, like I just enjoy life. Like I just want to like make the most out of every opportunity I can, and that's like the same philosophy that I have with hygiene. Like I don't want to like ever settle for mediocrity for anything, right?
Welcome.
Yeah,
There
I
are
mean,
more
like
of us, Tasia. There's more.
I swear to God, the
oh,
dental
100,
hygiene
That's
groups
our
are
love
ruining me.
language.
100%. And that was something that was like hard for me, especially as a male, is like all I saw was hygienists that like, I don't want to say did the bare minimum, right? But they weren't going above and beyond. I saw, the part-time mom that was my hygienist at my dentist growing up. And I was like, I don't want to do that. That's not me.
Yeah.
And so, trying to find those different opportunities and just like really maximize. I mean, we got one chance. Like, what are we doing if you're just like doing
We
the
have a
bare
part to
minimum?
play, and if we can provide a better service or like get people healthy or like collaborate
Yeah,
with medical professionals, like
Or
let's
do
do
what you
that.
love.
We are
Like,
right.
healthcare providers. Damn it.
I mean,
Exactly.
and I think like with anything, right? So like I did sports all growing up, like, and maybe that's part of where it comes from is like having sort of a competitive spirit.
That's true.
But like if you're doing sports, like what's the point of just riding the bench the entire time,
Amen.
Agreed.
right?
Agreed.
Like,
Because if you're not going to be the best, why are you there? Why?
I
right.
had this
Or if you're
conversation.
not going to try to be the best, right? Like it's funny because I rode the bench in high school. But I always like put in the effort, right?
Good.
And I felt like I could make an impact. I wasn't just, given the opportunity. But now
It's a good
I'm the one that
metaphor.
like gets to make my own fate, right? So I don't have a coach that gets to decide whether or not I get to go in the game. I get to be like,
Agreed.
no,
Yep.
I did the effort. I put myself into a place to where I'm getting
Yep.
put in the game. I don't care what you say.
See, and this, I feel like it's a very good metaphor for kind of what we talk about with hygienists who are like us, but are in an office where they can't fully be themselves, right? It's still
Yeah.
our job to be ready for the moment that we are pulled off the bench. And the
Yeah.
moment
Yeah.
you get
Yeah.
introduced to the office that fits your paradigm, you get the airway office, you get the holistic, you get the dream office, you get whatever it is,
Yeah.
or the rules change for us and we can all go be providers in our own clinic. Like we have to be ready for that next step because that's on us, right?
Yes.
We're working out,
100%.
we're working out our brain, we're working on our shots, we're doing all the things like shots and shots, we got them all. So
Yeah.
yeah,
Yeah. Well, and then you're creating that demand, right?
yeah,
There's not going to be unfortunately, there's not going to be the supply until there's the demand,
Yeah.
that's
right?
true.
And
That's a good
so
point.
if
Yeah.
you're not like it's opposite economics, but that's the way that it's going to work in a profession. So, even if it makes sense for there to be more autonomous roles with hygiene, if we don't have people that are ready to fill those roles immediately, it's
Yeah,
not gonna happen, right? Um,
exactly.
so yeah, no, I think totally like being ready to come off the bench is a fantastic analogy for that.
And
Yeah.
to your point about, kind of having the roles ready to be filled, I think that's why the OPA and that preventative oral assistant is even coming up, right? Because we have assistants, and assistants can get ready to be OPAs quicker than we could become mid-level, like nurse practitioner level providers. So those of you that are going to get your master's degree, Matthew, you'll be ready for something like that.
And that's part of why I decided to do the master's, is like I don't really have a specific goal with it. Like some people, they go because they want to be a dean or like be in public health or something. Like I was like, I don't know. I just want to do the most I can with hygiene. What that looks like, we'll see. And I think that's something that's going to continue to evolve, and that's something that I want to push to continue to evolve.
Good.
So I think that there's a great future in hygiene if we're willing to work for it and put in the effort, right?
Agreed. And that's what I think, like Tasia and I kind of come up with this idea that most of us who are like us, that we want to push our profession forward, we don't hate hygiene. We love hygiene. We want to make it better. We want to be proud of it, right? That's why we became hygienists. But when did you graduate?
December 2024. So a year and a half.
Yeah, you're still new.
I love it. I love it when people are new. Like you're new and you're still like you're advocating so hard and you're like advancing and doing all these things. And I think that's so amazing, because then you see some of these hygienists, who've been doing it for, well, I can't say us, but like you see some posts on the hygiene groups where I have to respond sometimes, but where it's like 30 years and they're like, I don't care anymore. I just want a basic office. And then you have all these people responding, it's me. And I'm like, well, great. I know now where I don't want to go work. Like, come on, guys.
I think that's really interesting, Anastasia, because I think it's really like maybe common's like a little bit of a strong word, but it's not uncommon for hygienists to follow this career trajectory, right? They graduate from school, they're like, I'm done. I don't want to do anything else, right?
Yeah.
They get into an office. That office has whatever standards they have.
Yep.
You settle into those standards. You lower the level of care that you're providing based off of the standards of the office.
Yeah.
And you do that. You do that for anywhere from 2 to 5 years. You look in the mirror and you say, is this really it? You get burnt out, and you either decide to get more involved, or you decide to complain, leave, pivot, look for something else, right?
Mm-hmm.
And my thought is, and again, I'm only a year and a half out, so maybe I'm wrong, but so far I don't think I am. But I think that if you decide to get involved from the beginning, here's an alternative route. Instead of me having to wait 5 years to be like, oh my gosh, I hate my career. What if I take the steps right now to avoid having that problem in the future, right? And then I see that all the time, like on social media, like before someone says something disparaging or negative, they always preface it with how much experience that they have. Like that's such a ridiculous notion that because you have 40 years of experience, you somehow know that this career is like terrible and that like I'm never going to be able to achieve anything.
That
and there's
shows
so
they are
much
not
negativity.
Well, no, I think it really just boils down to mindset, right? I just had this conversation with someone else, and when you bring up the OPA, I have like maybe a little bit of a different perspective.
Do tell.
I could see a world where an OPA is beneficial and helps fill a role that we don't necessarily need to, right? I mean, if you see a patient every 6 months that's always healthy, doesn't have like a high carry, those people exist. I see several of them a day in the office. Like, if I can do my initial education, like maybe we're not talking about cavities or gum disease, but maybe there's like airway issues or something, right? And I can have that conversation. Someone else can come and scrape off the crap on their teeth. Like, I don't think that that's something that like you would need my expertise for, right? I could see a world where that happens, right? I don't love the way that like the legislation was put out. I don't think that there was like great standardized like education and things like that. But I could see a world where, we can expand that scope. But when we talk about how a lot of hygienists respond to that, it's really defensive, right?
Yeah.
It's really territorial. And it's the same exact thing that happens when we say something and then a dentist is like, stay in your lane, right? Everyone's so territorial. It's like this fixed mindset of I can only do what I can do. And anything that kind of bridges that gap a little bit is an immediate threat to me. Where I believe that there's room for everyone. And so if we all look for opportunities for growth, that doesn't mean that I'm going to have less opportunity. That means that there's going to be more opportunity available for more people. Right?
Yeah. Because maybe this is like the pivot point for hygienists. Okay, if they come in and do this, now this gives us the opportunity. Where are we going to go from here?
Exactly.
Yeah.
So maybe this, let me play devil's advocate.
It gives us a chance to expand our role.
And it could. Maybe this is a good thing. Now, like you said, I wouldn't give it to, if you have perio or your perio maintenance patients, but no, but.
Right. No, not everyone. But I could see a world where there's certain things that are, like if we're talking about the mechanical things, like you can teach someone how to do it. Having the understanding behind why you're doing it, that's a different thing. And that's not to be minimized, right?
So then what are your thoughts on foreign trained dentists being trained as hygienist here?
I think it depends on the education. Like it just has to be standardized. Like if you pass your boards, if you have some amount of education, like whatever, you can do the same thing as someone. I do know, like from personal experience, I lived in Argentina for a couple of years. I went to a dentist there, and I didn't have a great experience. Ended up needing to get 2 root canals based off of the work that was done there. And then that's not to say that like an entire country has like lower standards, but I do know for a fact that at least there was one provider in a different country, one that wasn't good, right? And so there has to be some sort of standardized education or boards. If someone can prove competence, do it. Whatever, that's fine.
And then just be held to the same standard as the rest of us too.
That's it.
Exactly.
If you already have the education, if you did 4 years of dental school in a different country, you don't have to do 2 years of hygiene school here, as long as you know what you're doing, right? Like it's not the same scope, it's not the same education.
And they might be great, because they're coming from another country. They did all this schooling. Like they're probably so thankful to be able to work and make a little bit more money because they've trained for years.
100%.
They might even be like super gung ho, like let's do this and help push the profession forward too. Who knows,
I will say something about that though, and this is just based off of like experience from other foreign trained dentists that I've met. Most don't want to become hygienists. They do it so that they can become dentists, right? So at a point you kind of have to be like, okay, is this actually solving a workplace? Like, sure, you'll have someone for 2 years. Is that really what you want? To fulfill a shortage? That's a conversation that I think is worth having. But no.
That could at least be a valuable Band-Aid, because if we have somebody who can help this like mid-level professional, but I keep thinking this is a chance for us to create something like the medical model where you have the LPN, the CNA, the RN, you have the nurse practitioner, you have the physician's assistant. Like I think dentistry could have these levels. But I tell you what, my little cackles just went up because I'm hearing you say all of my favorite easy patients are going to go to an OPA and I'm going to scale my hands off every single day because I have the skill set to then deal with perio. That does not excite me. Selfishly, I would like to have a few easy patients a day. No, I don't want my hands to fall off. So then how do we balance that?
But the thing is, if you are you're seeing like a less quantity, right?
Yes.
Like you're going in, you're doing a periodontal assessment, you're educating patients, but you're not having to do the easy scaling, right? You'll see, perio maintenance or like SRPs or something like that. Like I'm just saying that's a potential model, right? I don't know exactly. I don't think OPA's really even taken off in Arizona or any of the places where it's passed. Um, but I could see a world where, if I'm only doing SRP and perio maintenance, like I'm not seeing 10 patients a day,
Yeah.
right? Like even if you have, what is it, like 50% of adults have perio or whatever, even if you're at that number,
70. Yeah.
oh yeah, wherever you're at, I don't know.
Yeah. Yeah.
I
It
think it
depends on where
depends
you
on like the
live.
region,
Yeah, it
right?
depends where you live. Yeah.
On your patient base.
Um,
I'm lucky enough,
yeah,
I work in a biologically holistic office. I mean, my patient base is their health and dental IQ is off the charts. So I
yeah,
literally have patients where I probe them every patient every time, and I have patients that literally don't bleed at all.
yeah,
Zero bleeding upon probing. That's how healthy my patient base is.
Mm-hmm.
And I know there's a hygienist out there who will never ever get to say that. So, where
I
do
know.
we, and that's the other thing, like, how do you build a practice that could build all of this? And so but these are the kind of questions we all have to have, right? Because
yeah,
now we get to
yeah,
brainstorm and then you go out into the world. And I really want to talk about that conference you just went in that was like the Integrative Health Summit or
Yes.
something. Talk
yeah,
about
yeah,
that.
yeah. So, it was really cool. It was the first one that the ADHA put together. So it was medical dental integration.
Mm-hmm. Yeah.
Um, and it was just talking about how healthcare's been like so siloed, right? And how we can kind of bridge that gap a little bit. An interesting thing though with that is healthcare was still fairly siloed at that conference that was all about integration because
Hmm. Oh,
it was
interesting.
coming
Yeah.
from hygienists. It was coming from a hygienist perspective. I was like, I know what a hygienist thinks. Like I've been to conferences.
Yeah.
We all say the same thing, right? Um, what from the medical side of things, like how can we better serve medicine or,
Yeah.
a chiropractor or a PT? I don't
Yeah.
know, like all of
Yeah.
these different things. Um, I would love to hear like that perspective of what do they view from an oral health
Yeah.
side, right? Because I know what we think. We think that like oral health affects everything and we're going to change the world by making sure that
Mm-hmm.
everyone's oral microbiome is great, right? Which to an extent is true. And I think that's an incredible thing about um, hygiene and oral health is like it is all connected, right? And so we can't just ignore what we're doing. But I think being able to find ways to where we can have conversations and bridge that gap between other professionals is super important. Like, one of the things for my master's program is I did an interprofessional collaboration course, and I
Exactly.
wasn't super familiar with a speech language pathologist. I knew that they like helped with speech disorders and stuff for young kids. But I met with one. She had a nursing background, and she actually helps people going through oropharyngeal cancer with like dysphagia and
Mm-hmm.
all of these other issues that come as a result of radiation therapy. Um, which I did a speech to a group of Hispanic cancer survivors all about considerations with like radiation therapy and
Mm-hmm.
xerostomia and things like that, with cancer, right? And
Yeah.
so we were able to have conversations, and I was able to make recommendations. Like there was a patient that his gums were so sensitive, he couldn't brush at all.
Mm-hmm.
And I was familiar with the product by Cureprox. They have like a surgical brush that's like incredibly soft.
Mm-hmm. Yeah.
Um, and I was like, you should recommend this to that patient. I don't know what happened because of that, right? But that's a way where we can see the
Access.
value
Yeah.
from medical dental because it's
Mm-hmm.
all connected, right? And so she was giving different substitutes for saliva I'd never heard about. So when I talk to patients about xerostomia, it's xylitol. Like that's pretty much it,
Yeah.
right?
Yeah.
Um, and even xylitol, like systemically, if we're ingesting a lot of that, there's considerations there. Um,
Mm-hmm. And if
but
someone has radiation chronic dry mouth, they're going to be using it a lot. So what could we also
right,
give them?
exactly. Yeah.
That's interesting. Yep. Mm-hmm.
So what other
And
products were they
Yeah.
talking
What'd you
about?
learn
I'm
about?
curious.
gosh, put me on the spot. I always have to reach out to her and see like what
Yeah.
it was.
The
Um,
one did they talk about Periovance?
We
It's
have that in the
the dry
office.
mouth gel with
yeah,
enzymes in it. I love that.
yeah.
Yeah,
I
Perivance is
think
great.
yeah.
That one seems to be one of the better ones. I have a patient that had really severe um effects from radiation therapy, extremely dry
Mm-hmm.
mouth, trismus, all the things, right?
Mm-hmm.
Um, and he had tried all of the products, and Periovance seemed like it was something that worked the best for him.
Mm-hmm.
Good.
But again,
That's
like
good.
that's a conversation you can have because I know there's some products that have like sweeteners in there, and if we're
Mm-hmm.
constantly, even if it's like honey or something like that, we're constantly introducing that to try and produce like some saliva or
Yeah.
lubricate the mouth. Like for me, I'm like, no, no, don't.
Yeah.
We shouldn't be putting that in the mouth constantly, right?
Like, don't do that
Um,
one. Don't do that.
but they're not
That's
thinking about that, right? So
no.
that's the
They
conversation
just want
that you
relief.
can have.
Mm-hmm.
Well, and the other providers aren't thinking about that,
Mm-hmm. Yeah.
Yeah.
right? And so you can be like, oh, this actually has an impact on their oral health. They're just thinking about the symptoms right now. And that's the same thing
Exactly.
that can happen with dental is we look at,
Yeah.
okay, here's the symptoms, let's treat them instead of being like
Yeah.
like grinding an airway, right?
Yeah.
We're like,
Mm-hmm.
okay, you're grinding. Let's treat the symptom
Yeah.
and not
Exactly.
make sure that
Yeah.
we're
Where's
like
the root
getting to the
cause?
actual cause, right?
Mm-hmm. Well, that's why these integrative summits are really good because I think about you are going to be surrounding people who treat oncology and radiation and whatnot.
Mm-hmm.
And now, if you get to say Periovance is wonderful, let's try this. They've never heard of it. Like, okay, we can
Right.
do pilocarpine or whatever.
Yeah.
But to your point, like I'm actually co-hosting a conference next month where I'm doing an intro to myofunctional and airway dentistry with a speech and language pathologist because what we're
Yes.
trying to do is identify what she sees that I don't and what I see that she doesn't.
That's
And
awesome.
Yeah.
we're teaching a mixed group on purpose because it is meant to teach both of us what we don't see but is right in front of our face because we have two different zones and two different scopes of practices with our training. And this is
Yeah.
the value of the integrative summit. And it'll be interesting to see if it gets better next year.
Oh,
Um,
I'm sure going forward. I mean, this was like the inaugural one, right? So
yeah,
they're
there's a lot to
just
learn.
trying to
Yeah,
get people to show up, right?
Yeah.
But I
exactly.
think that what
Yeah,
was there was awesome. There was like representation from the American Heart Association, different public
which
health
is great.
speakers and things.
Yeah.
Yeah, it was really cool.
Who were you the most excited to see there?
Gosh, it was in Colorado. Colorado hygienists are just different. They
Oh, I
they
mean, as
get to
far
do
as like
so much.
integrative, I think I'd be excited to see the cardiologist there. I mean, like, oh, these people are
Yeah.
actually doing something that we can all work together and grow the integrative part of it.
Mm-hmm.
Oh, you
That's
mean like in the future, who I would want to see?
that too. Where do you
Yeah, yeah,
that's
yeah.
a it's a good segue. Where do you see
Right.
Yeah.
everything going? Like what does Matthew see for the future of dental hygiene? What would you want to push it towards? Like whatever your master's thesis could be.
I think honestly the speech language pathologist, like for me, that was like really eye opening because it's so integrated into what we do like already naturally. It's the same structures, it's the same features,
Mhm.
right?
Yeah.
Um,
Yeah.
but two totally different perspectives when you're looking at the same exact thing.
Mm-hmm.
And I think if we could find ways to not necessarily have their perspective, but understand, and so you have both of those in mind,
Mhm.
and vice
Absolutely.
versa.
Yeah.
Yep.
I think that's one where it like makes a ton of sense, right?
Mhm.
Once you get into like all of the systemic, that's where people can get like a little maybe overwhelmed, right? Not
Mhm.
necessarily that it isn't a part of like your scope to have knowledge of how the body functions, but that's a lot.
Yeah.
I didn't go to medical school, right?
Yeah.
I studied your mouth. And
That's
I
it.
can have
That's your
like an
specialty.
understanding of those things and how it like correlates, but I think especially speech language pathology and like you were saying, myofunctional therapy and how those things can like work together. The more perspectives we can have while looking at the same thing, the better care we're going to give to someone.
Absolutely.
Absolutely. And I think for everything, like all collaboration, I think it'd be great because I just moved to Michigan, so I'm trying to find like ENTs, like even rheumatologists, cardiologists, to kind of I want to like go introduce myself and like see how can we work together, like
Yeah.
because I think it's
Well,
so
I mean,
important.
that's how it is with anything, right? Like
Yep.
that's how it is with working with the dentist in your office. Like for me personally, I'm like so focused on prevention and like maximize, and also like my natural philosophies are like try to intervene as little as possible. Like your body is meant to function, so allow it to function, right?
Amen. Yeah.
And so like my perspective with something like cosmetic procedures, like veneers, that I have a hard time like getting behind because like from my perspective and like the way that I view healthcare and like what we're trying to do, it's not what I view as important, right? Like I think that you can have aesthetics. You don't have to have veneers. Like I see so many people like they post their photos and it's like I got veneers and it's great. Like if you feel more confident with it, that's great. There should be a place where you can get that. But for me, it almost feels like a little bit of an ethical conflict where like
It's a good,
I'm like
better, best situation.
I want to preserve your teeth like as much as possible, but then I have to be in the situation where there's a doctor that really loves to do cosmetic cases and I have to be like I support that
Yeah.
and I don't
Just
you
like
know
in Myo, I think there's different levels, right? Because you're going to have that group that's all they want, right? They don't want to go through expansion and Invisalign, and they don't have the time or the money. And it's like with myofunctional therapy, I have girlfriends in my group who are like, I'm going to go get Botox in my TMJ because I clench and grind. And I'm like, I can help you with that, right? But they're like, but I don't want to take 16 weeks to do it. I want it fixed in an hour.
Yeah.
And so
yeah
I think, and to your point, you have to find the office that fits your ethos that really moves that. But I think one of the subjects that Tasia and I have kind of on our list of things we wanted to hit was, especially because you're still a new grad, like considered, what do you think hygiene school didn't teach us? Like you're so fresh out of it. How do we use your new perspective and you're hungry, like a hungry caterpillar to kind of
Especially
move
for all
along?
these
Like,
hygienists right now that are graduating, waiting to get
yeah.
licensed right now.
Where would you guide them? What do you want to take?
What would you say?
I would focus more on what hygiene does teach you, and hygiene school teaches you to pass your boards. That's it.
Yeah.
That's the point of hygiene school. For you to become the hygienist you want to be, that's on you, and that's on the things that you decide to do outside of school, right? So for me, that journey started while I was actually in school. So going to CE courses that were given like by my local component. I went to RDH under one roof. I think like if you can get to a national conference as a hygienist, changes your career. It changes your perspective because you see what people are doing outside of your circle of influence.
Yeah.
And you see the impact, the potential, the impact that your career can have, right? So, when I was just in school and I'm just trying to pass and get my patients in and survive, right? Get through it. And then I got out of there, out of school while I was still a student. It opened up my mind a little bit. It changed my perspective. I'm like, okay, this is what other people are doing. This is what's possible. And now I can take the steps during school to become the hygienist I want to be. Like, do I want to be the person that, talks about the oral systemic link? Do I focus on patient education? Because you can't do everything, right?
No,
You can't be perfect at however much I want to do it all. I want to be great at it all. But you got to come up with like, these are the things that like I really care about. Like, so for me, I'm really passionate about patient education. I don't want a patient to come into my op and them not receive high quality education of how they can take care of themselves.
Mm-hmm.
Great.
Now, I also invest into, advanced treatment modalities and all of that stuff. But like at the basis of like what I think really matters and what I care about and what I think makes a difference in someone's life, like I use a periodontal endoscope, and I would say patient education is more important than that, right?
True.
Um,
Because you don't want to have to use that on somebody. Yeah.
right, exactly. And if you
Yeah.
do use it on someone and they don't have education, you're gonna be using it again,
Exactly.
right?
That's true.
No,
Because we're
like I say,
preventative
we're
therapists.
20%. We're 20%. They're 80%. They cannot take us home with
Yeah.
them, so they
That's
have
true.
to be able to do the proper home care, whether they have implants, all on fours. Like if you
Mm-hmm.
don't show them, how are they going to succeed?
Right.
Or
And so hygiene school, to go back to that, it teaches you the basic of like, let's just stick
Yep.
with the example of patient education. It teaches you the basics of motivational interviewing, right? Um, does that mean that I can go out and practice and like give incredible patient education? No, not even close,
Basic
Yeah.
understanding. You're
right?
touching the surface.
It
That's an
gives you enough
interesting.
to where you're like not ineffective. But if you
That's
want to
true.
be the best you can, that
Mm-hmm.
comes from, trying different things out, right? So like I've learned a lot from different conversations I've had with patients, some that have gone well and some that haven't. And the ones that haven't have taught me a lot, right? But then also getting the perspectives from other hygienists, like going and seeing someone speak at Under One Roof or at ADHA, right? Those are the hygienists that are doing the stuff that like I wanted to be doing, right? And so getting their perspective of this is how I talk to patients. I might not
Mm-hmm.
copy it 100%, but it
To get new
changes my
ideas.
perspective.
Mm-hmm.
Yeah.
Well, that's why we swear by our guided biofilm therapy and our disclosing agent, because how can I ever show you and assume that you understand where you're lacking if I don't actually show you,
Yeah.
you know?
That
And
was a big thing for me. Like I started like disclosing for, I wouldn't say every patient, because again, we have like those healthy ones, and I'm like, okay, I don't need to bother you with all of this stuff. And, I think also being aware of like, efficiency is an important thing, right? Like you don't want to drown yourself with like doing all this extra stuff every single appointment. But for most patients, I disclose, I show them the mirror, and then we actually demo brushing like in the mouth, and they see that
mm-hmm.
their gums bleed from just brushing.
Mm-hmm.
Like that's not my pokey thing. Like okay, like
Exactly.
yeah.
this is a brush.
Mm-hmm.
Um, and that's something that I just like recently started doing. Did hygiene school teach me to disclose? Yeah. Did I understand the impact that that had? No.
No.
I thought that it was just the way that you're going to look, see if there's some pink, and then you're going to mark me down,
Exactly.
right?
Yep.
Yeah.
But
Dot your
once you get
marks,
out,
but
yeah, once you get out into practice and you get to actually become the clinician that you want to be, and a big thing
Mm-hmm.
is finding an office that supports that, right? That's hard.
Yeah.
it is.
But like going back to like what we were saying is you got to be ready for when that opportunity does come, or you have to create
Mm-hmm.
those own opportunities.
Exactly. No, you create them, and you push it
yeah,
forward. We push it forward. Yeah. Mm-hmm.
and you have to
And I feel
present
like
it in a way that like makes sense, right? Like
Mm-hmm.
when we're just because it comes down to money, right? That's always the thing. And that's really hard, like for us, because like OHI, if it does get paid, it's like $10 or something, right? And so if I'm
Yeah.
spending 40 minutes of my appointment talking to a patient about oral hygiene, I mean 40 is a lot. Sorry, like let's say like 20. I'll do a 20-minute OHI sesh.
Yeah.
Um, like you're not getting paid for that really. So that's kind of a hard thing, but trying to find a practice that values that, and allows you to create that kind of patient experience that you want, I think is super important.
Because
Mm-hmm.
we didn't go to school to be production horses, and I tell people it's not the production that comes out of hygiene, because we've talked about this so many times. Like if your insurance company's paying $40 for a prophy, there's only so much we can do. It's what comes out of hygiene. Are they doing Invisalign? Are we doing airway? Are we doing appliances? Like, are we doing preventative services? Because I feel like, and it drives me crazy because everyone's like brush and floss every 6 months for the past 30 plus decades. That clearly isn't working. So like, what are we doing? But again, I always say prevention doesn't make money, and I think that's part of the
I
problem.
see, that's where I would like take it a step further. We're saying prevention doesn't make money, and the research shows that like oral health hasn't really improved. Caries is still super
Mm-hmm.
prevalent,
Yep.
and we're still subscribing to this system that doesn't work. Like
Yep.
clearly, I mean, just based
Yep.
off of the research, right?
Right.
But like that doesn't make sense
It
to
doesn't.
me, right? So my future hope, no, it's not a hope. I'm gonna make it happen. My future goal is to practice independently and to make prevention profitable and help people understand
Mm-hmm.
how that is. And and here's an interesting thing is when you're talking about the profit of a practice and stuff, profit doesn't really mean any. I guess it depends on the practice structure. But so my personal experience, uh, recent grad, got into this mid-sized DSO, like 40 offices or so. Um, and I was like, I'm gonna change the world. I'm gonna make an impact. I was like super excited, right? And what I thought making an impact was being a high producer, right? I thought that's how I would be able to have conversations and get some clout and whatever, right? And so after probably 3 or 4 months post grad, I was like consistently a top 5 producer in the entire company.
Mm-hmm.
Uh, and then I had a conversation with someone about implementing like Kiridont and SDF and doing these sort of like early caries interventions. And I was told that I was a new grad that didn't have any clout. And I was like, cool. So the thing that I thought mattered doesn't matter.
Yeah.
Cool.
Yeah.
All right. So I made you money, and that doesn't help my case. Um, and it's interesting because the things that make the money, right, is those like adjunctive procedures. And so like I look back, I was paid based off of collections. And I look back and I'm like, can I truly say like 100% that like everything I did for patients was necessary, right? Because if I'm only getting paid $40 for a prophy, I'm getting paid 30% off of collections.
Yeah.
Working for $10 an hour, right? If all I'm doing is a prophy.
Yep.
That's
a
and
problem with the
honestly, like
office model.
that's a hard thing to say and be like 100% honest with myself and say, okay, did I provide the best care for that patient? Was that 1 5 millimeter pocket of bleeding an SRP? Was that what the patient needed? Like, they come back and that 5's now a 3. So are we really providing evidence-based care, or are we just providing based off of what insurance guidelines are, right? And like, I've even taken it like thinking about x-rays or even like prophy frequencies. When we're talking about that patient that comes in, they're always a 3s and below, no bleeding, everything's super healthy. They haven't had cavities in 10 years. Do they have to come in every 6 months? Like, what's the benefit of that? If they don't come in every 6 months, then we open up an option for someone that actually needs treatment and needs the help, right? I just I look at the whole insurance model and how we've done dentistry, and it's not patient based. Even when you try to make it patient based, right? And then when you try to make it patient based, you're selling. So like that's the conversation that I have with patients a lot. Not so much now because I've learned how to talk to patients better. But when I first started, and I would have conversations with patients about evidence-based care, I was selling to them, right? When I say, hey, you have bleeding let's keep a closer eye on this. That way things don't develop into periodontal disease. I come back in 3 months. Insurance isn't going to cover that. They're like, well, insurance isn't going to cover it. So like, you're just trying to sell to me.
Yeah.
Right. So we've created this model to where people believe insurance actually has their best interest in mind, and anything we're doing outside of it is shady.
It's like, where did this begin? Because nowhere else in healthcare do people go in and say, do they go to their cardiologist and say, well, no, I don't
need that EKG.
Please. No, I'm fine.
Yeah, exactly.
You know, it's only in dentistry. And I feel like it's because we've allowed it. We've kind of devalued ourselves, whether it's the doctors or the hygienists. It's a little bit of this, it's a little bit of that. But I also, because I'm from Canada and it's very different there in the way that we don't have coding. And I think the whole coding thing is bullshit. It's all an insurance driven money making business. There is no code. It's like you have 16 units of scaling a year, or 10 or whatever it is, 15 minutes each unit, and you use it how you should. So most people can go in every 3 months, which is fantastic. It's not like, well, now you're classified as perio.
And that's such a weird conversation to have with patients. I'm going to be like, I'm doing the same exact service, your insurance, and now they aren't going to cover it. They're only going to give you 80% off or something like that. You have to always pay out of pocket, and I'm going to ask you to come in twice more, and those ones are going to be completely out of pocket. Like, well, I'm providing the same service. Like, for me, it doesn't take any more time. Actually, my goal is my perio maintenances take less time because I'm seeing them more, and they're more educated, and they have a healthier periodontium. If they don't, then we need to have a different conversation. Something we're doing isn't working. But I should, like, my personal philosophy, if I'm seeing a patient every 3 months, that should be a 30-minute appointment because they already know all of the things. I don't have to go back over education all the time. I don't have to do all the things every single time. They should be taking care of themselves.
That's
right. I mean, I think about some of my PMTs definitely listen and definitely implement the things and definitely come in better, and others just don't. And then now, what if we had grades of that? Because what if you do have the 5 millimeter and up people, we could do pretty well with. But if you've got a 7 to 10 millimeter pocket and he's a PMT, that dude is never going to be a 30-minute appointment. And now, how do you code that?
Airway issues.
Exactly.
And his tooth flew out of his mouth last week, like my patient.
So, if they would implement, and that's, I think, what we all come out of hygiene school thinking we're going to change the world and the patients. And we come out like, I'm going to teach you all the things that clearly nobody taught you because that's how you got here. I think that switch in our mind is tough because you get slapped with real world information and insurances and corporate and or whatever, and limitations, whether it's by your doctor, your office, your insurance, your time, whatever it is, and then you go, well, dang, now I can't do all the things I wanted to do. And so I mean, because
for me, like, coming from Canada to the US was hard because I was like, we did in Canada, and then coming here I'm like, what makes this perio maintenance or this different than anything else I'm doing, because we treated everyone the same, right? So I'm like, so it's just a code. It's just an insurance code. But I'm not doing anything different at the end of the day.
It's just deeper. It's the same treatment, but deeper.
I've heard, but aren't you going to get everything out? Like, I'm not going to leave a little bit of something somewhere just because it's 1 millimeter deeper in one area.
Yeah.
I have OCD. Like, it's all coming off. I say your gums, teeth, and bone will be intact. Everything else is coming off. Like, I don't play. But it's like...
I love that.
Sometimes I don't even talk. I get focused. They're like, you're serious. I'm like, dude, what is happening in your mouth?
We got business.
Like, this is not okay. Like, I will talk to you in a second. I'm trying to get this piece out from the vacation that I love perio-DT. So, like, what do you say to the people who have, like, they haven't had a cleaning in a few years. They're young. They're pretty healthy. They have a few 5 millimeter pockets. Are we doing an SRP?
I mean,
because that it's going to heal.
Yeah. So this is the thing that, like, I don't know. I kind of have tried to, like, not focus on insurance and allow my patients the opportunity to have, like, not insurance-based care, right?
Yeah.
But just based off of my experience, like, I've seen, especially when it's isolated, if we're talking about, like, 5 millimeters in all 4 quadrants, like,
yes.
Okay, like, we've got something going on here. But if I see like 2 spots with bleeding and 5s, I'm like, okay, can we say for sure? I don't know.
Yeah.
I'm a fan of doing, depending on like how much bleeding there is, like if there's enough bleeding to do like the 43, 46,
Yeah.
or honestly just doing a prophy, but having them back in 3 months.
Yeah.
Right. And then I can recheck those areas. And then if they're still bleeding, then it's like, okay, now
Exactly.
we need to like go in there. Right.
Yeah.
But allowing them the opportunity to like take care of their, and like have that decision where I'm not in, like there's patients where like they don't get an option, right? If you're like a 6 or a 7 and you're like, no, we're not having this conversation.
Yeah.
But for those patients where, yeah, it has, they're young, it's been several years, I'm like, okay, is putting you into a perio protocol for the rest of your life, right? Because like technically that's what we would be doing. Is that really what's going to be benefiting you?
Right.
Or do we just need to go in there, disrupt the biofilm, and then you're going to heal up? We're going to talk about oral hygiene. So now you're going to take care of things at home. You come back in 3 months. We have a conversation. Yay, everything looks good. That 5's now a 3, no bleeding.
Yeah.
Boom, 6 months. Like, let's do what actually helps people.
Yeah.
There should be room for like
perio.
a
Do you always have perio? Because then you have, if you're doing salivary diagnostics and you've cleared all, pathogenic bacteria, does this person have perio? Then you have the patients who have no pocketing and have AA, PG, and TD and FF, so then it's like, where did this come from? You know what I mean? So you don't really know unless you're doing that.
But that's where I think that's the conversation for like a reassess and re-educate and then see them again at 3 months, right? Or your 6-week recall or whatnot. Because I think if you come back and you reassess and you see the same problems, then you know that it wasn't just a barnacle on the tooth, right? It wasn't just, it's okay. So we know we scaled, we took out, it's like what medicine does when you go to urgent care. They assume the basic like general thing, right? It's going to be 80% of the case will be this. So if we now have salivary diagnostics at our ready, if we have the microscope, if we have the airway conversation ready, if we have, the model where you can sit and talk to them, I think this is the next step that we're taking, right?
Yeah. Well, I think like you said, like 80% of the time it's going to be plaque induced. And so if we treat that,
if it isn't,
and they come back and we're like, okay, so now there's a conversation to be had, right?
Exactly.
Whether that's like systemic or if we're talking about like the oral microbiome or whatever. Yeah. I think that's evidence patient-based care.
Yeah,
exactly.
Right. Because I just want to send everyone for airway tests. I feel like
everyone has airway, but not yet. Well, so to your point about
that was something that was cool that I learned at the Integrated Summit, is because I'd have conversations with patients about airway, right? When like they open up and it's like a mountain potty, like 3, 4 or something, I'm like, okay, it doesn't look like you breathe at all.
It's important.
But then like I have that conversation, like, I don't know, talk to your physician about this in 6 months to a year when you next see them. Like, you're not going to remember the 5-minute conversation you had with the hygienist, right? That was about your airway, that you probably didn't really believe or understand all the way. But something I learned over there is, and a lot of times like insurance won't even cover sleep studies until like you've had like a heart attack or something like that. We don't include that as like preventative care. Yeah.
Is that true?
That's what I've heard.
Really?
It can be. Well, and then there's a 0 to 5 AHI rating. Like, you're not bad enough. You don't stop breathing enough, right?
Right.
Where is this limit start? If you stopped breathing at all, if your spouse reached over and choked you out,
probably not a good thing.
Right, exactly. It doesn't count. It doesn't count as murder because it was only 4 times. But if it was 5, now you got it.
Yeah. And so like we talked about airway there, and I learned about like at-home sleep studies. And so now I can have a conversation with patients where I'm like, okay, let's go outside of the insurance realm, and you can do this as like a screening, make sure that like nothing's a problem. And then, if you come back, everything's clean. Now we can do a night guard and I'm not closing up your airway anymore, whatever. Right. but I think trying to find those ways to where we can try and add value outside
Make
of
things
insurance,
accessible.
like that's something that's like hard, right? Like, because in school we don't talk about insurance at all. At least mine, right? Like you code
Yeah.
things.
Mm-hmm.
I don't know
Yeah.
what that means, right? And
We code
I
it,
know
we
what the
learn what
difference between
yeah.
1 to 3 and 4 plus teeth is. I can
Yeah.
count,
Yeah.
Yep.
Yeah. That's
but
true.
like the
Yes.
impact that has on care, I think that's what's different, is
Yeah.
understanding how what you do in the
Mm.
chair impacts someone's health. How you can
Mm-hmm.
see someone has a narrow palate and you get them in clear aligners to get some arch expansion, how that's going to affect their life, right? And how
Mm-hmm.
that is an additional service and value that we can provide that we're
Yeah.
not taught in hygiene school.
Yeah.
Ooh, I
Yeah.
think that's your closing statement right
Yeah.
there. It was like, what would you want everyone to know? I think
Yeah.
Matthew Bradley, the Guygienist, just dropped it. Boom. Man,
I
I
also
don't
have
know.
one
How do
last
we follow
question
that up?
well, I have a question because I feel like a lot of you talk about mindset a lot.
Yeah,
We have to grow. We have to find what it is we want to learn to progress and move forward in our career. There's a lot of hygienists right now that are working in environments that maybe their doctor's not in alignment with them. They're not allowed to do practice to their full scope, or if the airway is not discussed, or they're just not really supported.
right.
What would you say to them?
That's a tough one. Like,
Yeah.
that's how I felt in my first office, right?
Mm-hmm.
And actually got let go from that office because like we just weren't a good fit, and they could tell that like I just wasn't happy with what I was doing, right? That I was compromising the care that I wanted to be able to provide to patients. And I was fortunate to find an office. I wouldn't say a unicorn office, but I have an office that trusts me and allows me to run things enough. And
Mhm.
the hammer hasn't
That's
come
great.
down yet. I'm still waiting for that one. I don't. I feel like
If you're
one day I'm
doing
just gonna
everything
show
with
up and they're gonna be like,
integrity, yeah.
uh,
You have the right
but no,
intentions. You're going in. There is no hammer because you're doing exactly what you're supposed to be doing,
yeah,
not what an insurance edict has
right,
dictated.
Amen.
Hmm.
right. But I think it goes back to what we were saying about preparing yourself, right? So
Hmm.
for when you have that opportunity to come off the bench, and that's something that like easier said than done, 100%, right? To be still invested and care about something that you're not performing the way that you want to. Um, that's like you knowing that you are like should be the starter on the team, but you're on the bench,
Yeah.
right? That's a hard thing to overcome. Um, and I think part of it for me that helped me was continuing that growth. So instead of thinking,
Hmm.
okay, I'm prepared, I'm ready, I'm done, I don't have to
Yeah.
do any more preparing, right? Continuing to grow, and the more that you grow, the more opportunities open up. So,
Agreed.
like, I've had opportunities that have come that I never thought would happen, right? Like,
Hmm.
I was invited to go speak in Massachusetts this year. I was like, I'm a year out of school. What are we doing? Like,
Yep.
me? Uh, I think that same growth can happen clinically,
Yeah.
right?
Hmm.
And that's like the big thing. I try not to focus too much on like the social media or the things that I do outside of the op, because
Hmm.
that's where I feel like a lot of people try to outsource their um, fulfillment in their career, right? When they start to feel like hygiene in the op isn't quite the same, or what they want it to be, then they look for sales, or they look for
Hmm.
teaching and all of these
Yeah.
different things.
Yeah.
And I really don't think that that's the solution. I think
No.
that you can grow yourself clinically
Hmm.
and you can find ways to provide that value. And
Hmm.
so if you have an office that doesn't
Hmm.
support you, you still have to find a way to support your patients,
Yeah.
Hmm.
because
Yeah.
that's what it comes down to at the end of the
Yeah.
day. So if you have an office, like my office doesn't do anything with airway. We don't even do clear aligners anymore. So a lot of those conversations I'm having with patients, like we don't do in the office anymore.
But you can still educate them and give them
I'm
a
still going to
referral.
have the conversation with the patient, right? So I think that you dictate the level of care that you're providing. Like one thing that bothers me so much about the other office, where I worked for the first like 6 months, that DSO, is I was so focused on providing value as a number and production that I minimized the impact that I can have in the care that I provide for patients, right? So now, like I maybe did a handful of head and neck exams, never took blood pressure, hardly had conversations with patients about and like effective conversations about brushing and oral home care. I just did the things. I showed up, scraped the teeth, went to the next patient, scraped the teeth, and just did that over and over. Yeah.
And I think it's important because 26 years ago, that was me, you know? We didn't know then what we know now. And I'm like, God, so many patients, like I failed them, I feel like. But now, and that's what's great. And we're evolving and we're learning and we're growing and new technologies are coming out. And like, I'm so thankful for hygienists like you who are out there pushing the cause and fighting and evolving and growing and like putting the message out there. Because I think it is so important for people to hear, especially coming out of school.
Absolutely.
But really, at the end of the day, I think the most important thing is like no one else is in charge of your growth except you. And I think I see a lot of hygienists that they complain that their dentist doesn't support their growth. They won't buy them this. They won't do that.
Well,
if you want to provide a level of care, that's you. And you have to assume some of that responsibility.
I don't think we can outsource our education. You got to own your knowledge.
No. 100%. Yeah. And that's how it is like with every aspect of your career, right? Like if you want to get education, like high quality CEs, like there's a difference between the hygienists that just get CEs online versus the one
all the time.
Agreed.
Right?
Agreed.
And you're like, well, my doctor doesn't pay for me to go to these annual conferences. He only pays for me to go to the study club here locally.
It's only a few Starbucks, people. Just repriorities. It's don't get your nails done one month, whatever. It's just we have to. But Matthew, we're going to have to say thank you for hanging out with us. And
what we could talk for another 3 hours.
Clearly,
I know. Sorry.
But
you get me talking about like advocacy and like career growth.
We're going to have to have you on with specific agendas. But what I really appreciate is that you just showed everyone listening that graduation is not the end of learning. We keep going and you're responsible for it. And
absolutely,
I think it's wonderful. And where do you want people to find you?
So I'm primarily on Instagram, the _ Guygienist. I'd love to connect with people and like I said, we're all, when we all grow, there's opportunity for more growth, right? So anytime that I can have a chance to support someone else, even though I'm only a year and a half out of school, if I don't know everything, and I know that I don't know everything, but I know a lot of people. And, if I can help support anyone that's trying in any way to, grow their career or make an impact or do anything, I love that. Love being able to just connect and support. And that's what I think we all need to do, right? Yeah.
I love that. And thank you for doing everything you're doing out there. So
keep it up. Don't stop. And don't let anyone tell you you're too young or too new or too whatever to do it. You know what? You're perfectly motivated, and that's what you need. It doesn't matter what stage of your career you're in. Exactly.
100%. Yeah, thank you.
We'll have you back here again if you want, and we'll continue these conversations. But thank you so much for taking the time to be here with us today on The Unhinged Hygienist.
No, thank you guys. This was fun.
Thank you.
All right. Thank you, Matthew.
Thank you.
Thank you.
Bye.